Are boxers prone to certain blood disorders? Boxing is a physically demanding and competitive sport that requires athletes to be in top shape. Many factors contribute to an individual's ability to excel in boxing, including genetics, training, and overall health. In recent years, there has been a growing concern about whether boxers are more prone to certain blood disorders compared to the general population. This video will delve into this topic and explore the potential for boxers to be vulnerable to specific blood disorders. Understanding blood disorders. Before diving into the likelihood of boxers developing certain blood disorders, it is essential to understand what blood disorders entail. Blood disorders are a wide range of conditions that affect the components of blood, such as red blood cells, white blood cells, platelets, or plasma. These disorders can vary in severity and include conditions like anemia, thrombocytopenia, leukopenia, or even clotting disorders. Exploring genetics. Genetics play a significant role in determining an individual's susceptibility to health conditions, and blood disorders are no exception. Some blood disorders are inheritable, meaning they can be passed down from parents to their offspring. For example, sickle cell anemia is an inherited blood disorder that predominantly affects people of African descent. However, this does not necessarily imply that boxers, specifically, are more prone to these inheritable blood disorders. Physical impact. Boxing is an intense sport that subjects the body to significant physical stress. During a match, boxers experience a range of physical trauma, including blows to the head and body. These impacts can result in bleeding, bruising, and potential damage to internal organs. While these immediate physical effects are concerning, can the physical impact of boxing on the body also contribute to an increased risk of blood disorders? The role of nutrition. Nutrition is crucial for maintaining overall good health, and it plays an essential role in blood cell production and function. Boxers, like any other athletes, need to maintain a balanced diet to support their intense training regimens and physical demands. Poor diet choices or inadequate nutrient intake can lead to deficiencies, which may affect blood cell production. Anemia, for instance, is a blood disorder caused by a lack of iron, vitamin B12, or folic acid, all of which are necessary for red blood cell production. Weight cutting. Weight cutting is a common practice amongst boxers where they attempt to shed excess weight before a fight. While this practice is used to gain a competitive advantage, it can have adverse effects on the body. Extreme dehydration methods and rapid weight loss can disrupt electrolyte balances and impact blood plasma volume. Such imbalances can increase the risk of blood clotting disorders and potentially compromise overall blood health. The impact of training. Boxers undergo intense training sessions to improve their strength, endurance, and speed. These training methodologies can push the body to its limits, resulting in increased levels of physical stress. Studies have shown that extreme physical exercise can impact blood cell counts, specifically red and white blood cells. This transient alteration in blood cell levels should not necessarily be equated to the development of blood disorders. However, it highlights the importance of regular health monitoring for boxers to ensure their bodies can cope with the physical demands of the sport. While boxing involves physical stress and trauma, it is crucial to understand the potential impact it may have on blood health. Boxers are not inherently more prone to certain blood disorders. Rather, aspects like genetics, nutrition, weight-cutting practices, and training intensity can contribute to an increased risk. As with any sport, regular health monitoring, balanced nutrition, and proper training techniques are vital for the overall well-being and blood health of boxers. Further research into the long-term effects of boxing on blood health is warranted to provide clearer insights into this matter.